In this video, we are going to discuss the study designs, how to classify study designs, and to indicate their importance of selecting an appropriate study design in order to find answers for the research questions. First of all, a study design is a specific plan developed by the researcher for conduct of the study, and this will allow the investigator to answer the research questions. So it is a part of the proposal explaining the basic steps and the procedures that will be implemented by the investigator to find answers for the research question. It is included with other elements of the research methods or materials and methods of the proposal. For example, the sample size, the sampling technique, and the method of data collection, and the plan of data analysis. And the basis of a good quality research is an appropriate study design that will enable the researcher to answer the research questions through obtaining the results and the outcomes of the conducted research. It's important to consider which criteria which you have to care for while selecting the research design. The first of all is that the relevance, that the study design should be relevant in the sense that it will enable the investigator to answer the formulated research questions. And the other aspect, on the other side, it's necessary to that the researcher should first formulate clear research questions. If the research questions are poorly formulated, then the selection of the appropriate design will be difficult and confusing for the researcher. Thus, the investigator or the researcher needs to emphasize the formulation of the research question, and then after that, it will be easily for him or her to select the appropriate design that will enable him or her to answer the research questions. The other criterion is that the design should be visible within the available resources, within the available time, and the researcher needs to assess the available human, physical, or financial resources or laboratory resources that are needed for the conduct of the research, and as well as the time allotted for the research. So always logic to select an appropriate design that require reasonable resources that can be secured for the conduct of the study. One of the requirements that makes the research ethical is scientific validity. And the scientific validity of the research is determined by many elements of the methods, including the design, the sample size, the sample technique through which the investigator will select the sample elements, etc. There are so many elements that will empower or enforce the scientific validity, and this is related also to the ethical aspects of when coming to review the ethical to review the proposal ethically. And as well as the design should be simple and not complicated, and as well as scientifically valid. It's of utmost importance to avoid unnecessary complexities. Then novelty, in that this means that the design expected to enable the researcher to achieve results that are new and adding to the existing scientific knowledge and database. Now we come to discuss the study design classifications. Study designs are structured approaches to address specific research questions, and they formulate approaches and mechanisms of the study conduct, such as the sample size estimation and the sampling technique, the data collection methods, the data analysis plan, ethical considerations, etc. There are many classifications of the research design, resulting in confusion and dilemma. For examples, we have the aim-based classification and the epidemiological classification and the investigator's role-based classification. We are going to discuss each classification and to look how they are related to each other. The aim-based classification, the study designs can be classified based on the overall aim of the study as follows. Descriptive study design, which aim is to search for facts, to search for basic facts around a certain problem. And then the second category is the analytical study designs, which aim to search for causes, to find etiological association between variables, between, for example, smoking and CA lung, between exposure to asbestos dust and mesothelioma of the pleura. And the third category is experimental study designs, which aim to put solution into action. You have a new drug and you want to test its therapeutic efficacy, and you, for example, or you have a new vaccine that you are interested to test for its effectiveness in protection against a certain disease. Some authors classify studies according to the origin of the data into primary studies, which include descriptive, analytical, and experimental. And this will show us that the two classifications are interrelated, but here we are focusing on the source of the data. And as well as the second category, they classify the secondary studies as systematic reviews and meta-analysis. And now let us define what is meant by systematic review. Systematic review is a critical assessment and evaluation of all research studies that address a particular clinical issue or a problem. The researcher use an organized method or approach of locating, assembling, and evaluating a body of literature on a particular topic using a set of specific criteria to come up with the systematic review report. A systematic review typically includes a critical appraisal of the included studies. Definitely, they should be related to the topic selected or the issue, and a description of the findings of the collection of the research studies. The meta-analysis, on the other hand, is similar to a systematic review, but the researchers take the process one step further by combining data from the included research studies and using the pooled data to come up with new statistical conclusions, in the sense that a meta-analysis is a statistical process that combines the findings from individual studies. It's important here to remember the definition of epidemiology, as we are going to discuss the epidemiological classification of study design. Epidemiology is the study of disease frequency, disease distribution, and determinants of the disease among human populations. And usually, when we talk about disease determinants, it includes both the cause and the risk factors pertaining to the disease. In this classification, the epidemiological classification, study design are usually classified as follows: case report, case series, ecological studies, cross-sectional studies, case control studies, cohort studies, and experimental studies. If we compare the aim-based classification and the epidemiological classification, then we can find out that the two classifications are interrelated as follows: that the first four epidemiological study design are descriptive in nature. If we talk about the case report, or talk about the case series, or talk about the ecological or correlation study, or we talk about the cross-section study, the descriptive cross-section study. And then if we look to the fifth and sixth epidemiological studies are analytical in nature, namely cohort study designs and case control study design. The seventh is experimental in nature, such as randomized clinical control trials and preventive trials. It's important to mention that the first two designs, namely the case report and case series, are commonly used in clinical rather than in epidemiological studies. However, they generate hypotheses that can be tested through other rigorous epidemiological designs. Now we come to discuss the investigator's role-based classification. And here we have two categories of study designs that can be distinguished based on the role of the investigator in the study. For example, if you talk about observational study, the investigator does not intervene or manipulate, but instead observes the natural occurrence of the events. Experimental study, the investigator intervenes or manipulates and then finds the outcomes of the study. Here there is important illustration which is cited from Grimes, DA, and Schools under the title "An Overview of Clinical Research: The Lay of the Land," Lancet in year 2002, 359, page 57 to 61. I think this is very interesting and very important for any individual to understand exactly the research designs or the study designs. And at the top here, we can see that there is a question, which is, did the investigator assign exposure? And then either yes or no. So when you read any article, then you have to ask yourself, did the investigator assign exposure? And then if yes, then this is experimental study, and it could be random. Then you ask yourself, if the random allocation, in the sense that the individual, the participants are randomly allocated either to treatment group or to control group. If the answer is yes, then this is a randomized clinical control trial. If no, this is non-randomized clinical control trial. On the other side, if the answer to the question, did the investigator assign exposure, is no, then this is observational study, in the sense that the investigator did not intervene or manipulate. And then you look whether there is any comparing group or comparison group. If yes, then this is analytical study. If no, this is descriptive study. And then after that, you check for the direction of the study. If the investigator started with cases and control, and then you look back to find the exposure to the disease, then starting with the outcome of the which is the disease, and then to look for the exposure in the past. This is case control. Or if the individual in the investigator subdivide the individuals into two groups, exposed and non-exposed, in the sense that the study starts with the identifying the exposure status, and then you follow them over a period to find the outcome of that exposure, whether they developed the disease or they did not develop the disease. That is cohort study design. And if the investigator finds the exposure and the outcome simultaneously at one particular point, then this is a cross-sectional study design. It's important that you revise this figure, which summarizes the categories of the study design, and we enable the beginners especially to understand exactly how to identify the study design. And in the coming videos, we are going to discuss in details each design. It is important also to remember that the question at the top of the figure, which is, did the investigator assign exposure? Or in other words, did the investigator intervene or not? And then the practical approach to learn the categories of the study design is to read published articles, so that you can be acquainted with the categories or types of the study designs. But it's important that the starting point should be always the question, did the investigator assign exposure? Did the investigator intervene or manipulate or not? And then to proceed on as shown in that figure. Thank you very much.